Hello and welcome to a new episode of Homeopathy for everyone. Today I'm going to talk about another very interesting remedy which I mostly use in urinary tract infection, which is very common, and specifically those infections which are recurrent. The remedy name is Colibacillinum, which is made from the bacteria E. coli. It's a nosode. I use this remedy very often in recurrent infections where the conventional medicines doesn't help, or homeopathy remedies stop working and fail to produce the satisfactory results. So in those cases, stubborn cases of infection, I use this remedy. Let me illustrate this remedy a little bit further with the case example. I remember a case of a 50 years old male who came to me with severe infection, urinary infection, which was recurrent after every few weeks, and he was hospitalized almost 2 times a month. And he came to me. He was around 50 years plus, and he was disabled because of a car accident. The main complaints of this patient was the recurrent infections, and the main aspect of the case was that he do not feel any pain because he's totally paralyzed from abdomen to the legs. Whenever he got this high fever, then doctor hospitalized him every time for a few days and gave him antibiotic course. And then his fever subside and he came back home. But after a few weeks, UTI come back. So because of that, he was feeling very, very weak and extreme tiredness. He gets blood in his urine, and according to him, the urine was very smelly and a dirty color, but it was blood, trace of blood in the urine. So he said whenever he get this UTI, then he feel extremely cold inside. So he has to wear a lot of clothes during that time. And in last 2-3 months, he lost almost 10-12 kg weight because during this episodes, he lost the appetite. So he hardly eat. Usually what we see in UTI is that if anybody get this UTI infection, they usually get extreme pains in abdomen or while urinating or after the urine. But because he was total paralyzed, it was difficult to get any specific symptoms related to pains or urine. So it was a complete numbness. I mean, complete loss of feeling from abdomen to downwards. So he only has this blood in the urine and a smelly urine, and there was nothing else except this high fever and cold shivering. This was his specific symptom. Personality wise, this man was very good mannered, extremely humble, and very high religious feeling, extremely religious inside. Always talk about religious issues, and he also taught his children about sacrifice for others, and his whole life was about sacrifice for others. In consult, he was very happy about this sacrifice, that look, I have given so much to my brothers and sisters, although they have this endless desires, but I have given my things to them. And his family was even not comfortable about his sacrifice issues because he has given a lot of his property and wealth to his brothers and sisters and family members back in home. He just gave them without thinking about that. His own family, his children's and family, wife was suffering from poverty, but he was so determined to help others that he has given not a second thought about that. So this giving, this sacrifice feeling was very high in his personality. Now let's analyze the case. What we see in this case is a very carcinogen, sacrifice, religious feeling, giving others a feeling, and Staphysageria, this phenomena of sacrifice, deep religious feeling, and controlled manner. Is a very carcinogen, Staphysageria kind of personality. Keep in mind, both of these remedies have this sacrifice feeling, giving yourself for the others, like a carpet feeling. There is another remedy which is folliculinum. It's also like they are also like doormats, like everybody put their feet on. So there are many other remedies, but there are these three specific: carcinogen, Staphysageria, and folliculinum have this very specific feeling of like a doormat. They give all of what they have. And this Colibacillinum, they also have this feeling of giving everything to others. But his behavior led me to the remedy belong to the parasite bacteria kind of group, because he has this feeling of worthlessness, like he has no worth, and others are using him, others are eating him up. Although others are taking his food, he dislikes them, but still he cannot he do not want to resolve the issue. He just willing to give all what he has. I have given him Colibacillinum, which is made from E. coli, which is the almost 70% cause of UTIs. In those cases where the infection is coming again and again, and your conventional remedies are not helping, or helping for a time being, then you must think of this remedy in those cases, and you must give this remedy a chance to help you further with the case. Sometimes I give this remedy few doses to stop the recurrent of the infection. And this remedy has very profound mental and physical symptoms. As I told you, that this remedy has this very profound urinary symptoms like pains, burnings. Same with the mentality. This remedy has this very high timidity. These people are very shy. They lack the confidence, and they hesitate, always hesitate, making decisions, cannot decide anything. They have this constant mental confusion. Remember, I have spoken about this aluminum, magnesium, and natrums. So this remedy look like aluminum, and in some cases magnesium as well, that they cannot express. And these people of E. coli, the Colibacillinum, they also have this memory issues. They forget things. Now let's talk about its potency. I have given this Colibacillinum mostly in 30 or maximum in 200 potencies, and in those cases which have this recurrent infections. There is another remedy which comes very close to this remedy when it comes to infection which are related to fever, or fever related to the infection, which is pyrogenium, which is made from the infectious substance. So that remedy also had this infection plus fever. But when you think of this urinary infection and fever, then you, instead of thinking pyrogenium, you must think of this E. coli. The pyrogenium works well in cases where the temperature comes with chilliness and rises high and then subside with perspiration. So actually what happened is before the fever start, patient feel a lot of chilliness, and then the fever rise very high, and then patients start sweating, and then the fever goes down, it subsides. But in the cases of Colibacillinum, you don't got this very high sudden rise of the temperature. It has this very slow rise of this temperature. Some women experience this infections and high temperature after the delivery because of septicemia or some other issues. In those cases, you must think of pyrogenium or E. coli if there is a symptoms there. So you must think of these two remedies on those cases. Jito listeners, this was today's talk. If you have any questions, let me know. Speak to you later. See you next time. Bye.